Hello friends, Wink Martindale here for 1-800-MEDIGAP, America's trusted source for Medicare supplemental insurance. Did you know there are big differences in the premiums that insurance companies charge for exactly the same Medigap insurance coverage? Hello, Wink Martindale for 1-800-MEDIGAP. When you need help navigating the Medigap insurance market, call 1-800-MEDIGAP to connect with your personal insurance navigator. They'll guide you to the most cost-effective Medigap supplement plan for your unique situation. And best of all, their help is free. Yes, free. 1-800-MEDIGAP is A+ rated by the Better Business Bureau and endorsed by Esteemed Living. Connect today. It's free and easy to let our experts serve you. Call 1-800-MEDIGAP 24 hours a day, 7 days a week, or connect online at 1-800-MEDIGAP.com. 1-800-MEDIGAP also offers medical gap health insurance for individuals and families, making 1-800-MEDIGAP the smart call for all ages. Connect now. You'll be happy you made the decision to go with 1-800-MEDIGAP.
So, time to start looking into Medicare? Here are a few basics to get you started on your journey. Medicare is a government health insurance program. It's for those of us age 65 and over. 65 and better, I like to say. And for those who qualify by disability. Original Medicare is a federal program, and it's made up of two parts you may have heard about. Part A is hospital insurance. It generally covers some of your costs in a hospital or skilled nursing facility. And Part B is medical insurance and may help cover doctor visits, preventive care, lab tests, and more. There is another option to get your Part A and Part B Original Medicare benefits, and it's called Medicare Part C or Medicare Advantage. Medicare Advantage plans are offered through private, Medicare-approved insurance companies. You may be asking, why would I choose this option? Well, some people like the extra benefits many plans have. For example, some Medicare Advantage plans may cover gym memberships and rides to see your doctor, which Original Medicare typically does not. And many Medicare Advantage plans include other extra coverage that Original Medicare doesn't have, like routine dental, hearing, and vision care. Most Medicare Advantage plans even include prescription drug coverage. But suppose you don't sign up for Medicare Advantage and you still want prescription drug coverage. You can enroll in a standalone Medicare Part D prescription drug plan to work alongside your Original Medicare coverage. These plans are offered through private, Medicare-approved insurance companies. No matter what type of coverage you choose, no plan is free. There'll be some costs. Here's a quick rundown. A premium is what you have to pay monthly to get coverage, whether or not you need care or services. For Part A, most people do not have to pay anything. But if you or your spouse haven't worked at least 10 years and paid taxes, then you might. Most people do pay a monthly Medicare Part B premium. And when it comes to premium costs for Medicare Part C or Part D, those will vary among plans. Some Medicare Advantage plans have $0 monthly premiums, but whether they are $0 or not, you'll still have to pay the Medicare Part B premium as well. The Part A deductible is the portion of hospital services you have to pay before your Medicare coverage kicks in. The Part B deductible is an annual amount. You may need to pay it before Medicare starts helping you pay for your Part B medical services. Medicare Part A and Part B may both charge co-payments or co-insurance when you receive covered healthcare services. For Part A, you typically don't have to pay co-insurance for the first 60 days you're in the hospital. After that, you do pay a daily co-insurance amount. For Part B, you'll pay 20% of the cost for most covered services. Medicare Advantage plans and standalone Medicare Part D prescription drug plans may also have deductibles, co-payments, and co-insurance amounts to pay. I want to tell you briefly about one last option, Medicare supplement insurance plans. These are sold from private insurance companies and work hand in hand with your Original Medicare. They help pay your out-of-pocket expenses, and some even help pay the Medicare Part A deductible and emergency medical care when you're traveling. It's important to know that this type of insurance is totally different from Medicare Advantage. In fact, you generally can't sign up for both types of coverage. Here's a very simple chart to recap the main differences between the plans we've discussed. This might be a good time to pause the video and look more closely. Or you can find helpful articles and lots more information at the eHealth Medicare website. So you may be thinking, wow, this is a lot to take in. Now what do I do? Don't panic. You've got this. The first step is easy. Make sure you've signed up for Original Medicare as soon as you're eligible. Many of you, when you turn 65, will be automatically enrolled if you're currently receiving Social Security retirement benefits. But if you're not, you need to sign up for Medicare during your initial enrollment period. For most people, this 7-month period starts 3 months before your 65th birthday month, includes your birthday month, and goes for another 3 months. If you need to sign up for Medicare, you can visit ssa.gov and fill out an application. Then decide what other coverage options you may want. The best time to sign up is generally when you first qualify for Medicare. You can start comparing plans anytime on our website. I hope this brief introduction to Medicare has helped you get a handle on what Medicare is all about. If you have questions, visit the website or call to speak to a licensed insurance agent. Thanks for watching. When it comes to planning your Medicare coverage, there's some deadlines and dates you'll want to be aware of. In this video, we'll answer 2 important questions. When are sign-ups, and when can I make changes? So grab a pen or a cell phone and let's fill in that calendar so we don't miss anything. Your first step in this journey is making sure you are signed up for Original Medicare. This will be available through the government and it consists of Part A and Part B. If you're already getting Social Security benefits when you qualify for Medicare, you don't have to sign up. You get enrolled automatically and you'll get your Medicare card in the mail. If you don't get enrolled automatically, your first chance to sign up is during your initial enrollment period, also called your IEP. For most of us, our IEP is a 7-month period that starts 3 months before our 65th birthday month, includes our birthday month, and goes 3 months after that. If you qualify for Medicare before age 65 due to disability, your IEP is often similar, but instead of your birthday month being at the center of that 7-month period, it will usually be the 25th month after you started getting Social Security disability benefits. If you're younger than 65 and have Lou Gehrig's disease, ALS, or end-stage renal disease, contact Social Security to see when you qualify and what you need to do. If you missed your IEP, or maybe you decided to delay signing up for Medicare, don't worry. You can sign up during the General Enrollment Period, which runs from January 1st through March 31st every year. Be aware, though, you could owe a late penalty. In some circumstances, you might qualify for a special enrollment period. For example, suppose you or your spouse is still working and you're covered under an employer's group plan when you turn 65. It may not make sense to enroll in Medicare Part B and pay its monthly premium when you're already covered and probably also paying a premium. But don't delay enrollment without checking with Medicare. In some cases, it may be best for you not to delay Part B enrollment. In cases like this, you generally have 8 months to sign up for Part B after employment ends or after your employer's coverage ends, whichever happens first. Now, there is an alternative way to get your Original Medicare Part A and B benefits, and it's called Medicare Advantage, also known as Part C. Medicare Advantage plans are offered from private, Medicare-approved insurance companies. A good time to sign up for a Medicare Advantage plan is when you're first eligible for Medicare, during that initial enrollment period we just talked about. If you missed that or delayed your enrollment, then your Medicare Advantage sign-up period will be different and probably shorter. It would be hard to cover those details in this video because they will be specific to your situation, so you might want to call one of eHealth's licensed insurance agents for some help. Most Medicare Advantage plans include prescription drug coverage. But if you decide to stay with Original Medicare, it's important to remember that Parts A and B don't cover most prescription drugs you take at home, so you might want to sign up for a standalone Medicare Part D prescription drug plan, or PDP. Medicare Advantage plans and PDPs share several of the same enrollment periods. When it comes to enrolling and making changes to your Medicare Advantage plans, or PDP, make sure and mark the annual election period on your calendar. From October 15th through December 7th, you can do several things. Sign up for a Medicare Advantage plan, sign up for a PDP, switch Medicare Advantage plans, switch PDPs, or drop your Medicare Advantage plan and return to Original Medicare. This election period occurs every fall. This is when it could really make sense to shop around, not only for better coverage, but for pricing as well. Now, if you already have a Medicare Advantage plan and want to switch to a different one, there's also the Medicare Advantage Open Enrollment period, which runs from January 1st to March 31st each year. This is another opportunity for you to change from one Medicare Advantage plan to another, or drop your Medicare Advantage plan and return to Original Medicare. If you choose the second option, you can sign up for a PDP during this period as well. And here's a great tip that you might not have heard of. Did you know that it might also be possible to sign up for a Medicare Advantage plan or PDP at almost any time of year? It's during what's called the 5-star special enrollment period. Medicare rates certain plans based on patient and provider surveys, among other things. And if a plan in your area gets a 5-star rating, you can sign up or switch to it almost any time of year. Click details in eHealth's plan comparison tool to see the star rating, or call and ask one of their licensed insurance agents. Medicare Advantage plans and PDPs also have special election periods. Some common circumstances include losing your coverage because your plan leaves your area, or if you move out of your plan service area, or maybe you move into or out of a skilled nursing facility or long-term care hospital. In situations like these, Medicare doesn't want you to be left without coverage for something unforeseen or out of your control, so they will offer these additional times for you to enroll. The final topic we should go over is Medicare supplement insurance, also called Medigap. These plans help pay the gap between what Medicare covers and your out-of-pocket costs. They work alongside your Original Medicare and cannot be paired with a Medicare Advantage plan. You can't have both. You have to be enrolled in Medicare Part A and Part B. But your Medigap open enrollment period starts the first month you're 65 years or older, and you have Part B. Some people delay Part B enrollment when they're first eligible for Medicare. What's nice about these plans is that you can apply at any time, but the best time to enroll is usually during your Medigap OEP, and here's why. If you apply during your Medigap OEP, insurance companies are not allowed to reject your application because of an existing health condition. It's a guaranteed acceptance. If you apply at a later time, you might be rejected or have to pay a higher premium. Okay, we made it through. I know it's a lot to remember, but by marking your calendar and considering your options, you'll be doing yourself a huge favor. Here's a quick recap of some of the main enrollment dates to mark on your calendar. If your 65th birthday is coming up, you can usually sign up for any of these coverage options right around your initial enrollment period. If you missed or delayed your initial enrollment period, then these dates might be important to you. Keep in mind that if you don't sign up for Medicare prescription drug coverage when you're first eligible for Medicare, you could face a late enrollment penalty if you decide to get it later. And if you already have a Medicare plan, keep that annual election period in mind. It happens each fall. That's when you can shop around and change your coverage if you find a better plan for your needs or a better fit for your budget. For some more in-depth articles about enrollment periods and other important Medicare information, visit the eHealth Medicare website. Or if you have questions, call to speak to a licensed insurance agent. Thanks for watching. If you're coming up on 65, you may have heard your friends talk about Medicare options, different benefits and plans, what works and what doesn't. And maybe you're thinking, I thought Medicare was Medicare. Well, you've come to the right place. In this brief video, we'll talk through your options and why people choose different plans, and then you can decide what's best for you. Let's start at the beginning. There are basically two parts that make up Original Medicare, which is offered through the government. Part A is for hospital costs, and Part B is for doctor visits and other medical care. You can stay with this coverage or look into an alternative way to get these same benefits through private Medicare-approved insurance companies. It's called Medicare Advantage, also referred to as Medicare Part C. To qualify, you need to be enrolled in Medicare Part A and Part B, and you need to live in the plan's service area. So if a Medicare Advantage plan is just giving you the same benefits as Original Medicare, why choose that option? Smart question. That's where the Advantage part comes in. These plans can offer a range of extra benefits. Plans vary, but here are just a few that may be offered. Some plans also include routine dental, hearing, and vision care that are not covered with Original Medicare. You can even get one simple plan that includes prescription drug coverage. In fact, if prescription drug coverage is really important to you, you might want to go a step further and compare each plan's formulary. That's a list of specific medications that the plan covers. Prices vary too, so it really pays to compare, and you can easily do that on our website. Medicare Advantage plans might be sounding pretty good, right? But with all those benefits, aren't they expensive? You might be surprised. Many Medicare Advantage plans have premiums as low as $0 per month. Now, keep in mind that there are other costs. The government requires that you still pay your Medicare Part B premium. And while some plans do have $0 monthly premiums, some will charge a premium. With some plan types, your co-payments and co-insurance might be higher if you go outside the plan provider network. Costs vary among plans. Some Medicare Advantage plans have annual deductibles. After you pay your annual deductible, you pay co-insurance or a co-payment for covered services. To protect you from very high medical costs, every plan has an annual out-of-pocket maximum limit, and after you spend up to the maximum, the plan pays your covered medical expenses for the rest of that year. This maximum varies by plan. If you don't go with a Medicare Advantage plan, let's talk about your other options. If you stay with Original Medicare, you can then add on a standalone prescription drug plan, also called Medicare Part D. These plans are available from private, Medicare-approved insurance companies. It's important to note that if you're enrolled in a Medicare Advantage plan with a prescription drug plan included, and you sign up for a standalone Medicare prescription drug plan, you'll be dropped from the Medicare Advantage plan. You don't need both, and you generally can't have both. Your Medicare Part D may come with some costs, such as monthly premiums, annual deductibles, co-payments, and co-insurance. Something else worth mentioning is that your out-of-pocket limits will work a little differently under Part D. Medicare has built in what they call phases of your coverage. Once you meet your annual deductible, these phases have maximum limits to help contain your out-of-pocket costs. And lastly, here's one more option to consider. You can choose to stay with Original Medicare and supplement your coverage with what's aptly named a Medicare Supplement or Medigap insurance plan. These plans help pay for the gap between what Medicare covers and your out-of-pocket expenses. They can pay some or all of your Medicare co-pays, co-insurance, and more. Some plans cover your Medicare Part A deductible and even limited emergency medical care outside the country. It's important to note that you cannot have a Medicare Supplement plan and a Medicare Advantage plan at the same time. These plans are standardized with lettered names in most states. For example, the Medicare Supplement Plan G in Oregon will include the same basic benefits as Plan G in Florida. To qualify, you are required to be enrolled in Medicare Part A and Part B. A hallmark of this option is that you don't have to live in a specific service area, which makes this a good fit for those who travel. Your Medicare Supplement plan will typically require you to pay a premium, but most plans don't charge co-payments or co-insurance. They also cover all of your Medicare Part A co-insurance for a year after your Part A benefits run out. And they usually cover at least part of your Medicare Part B co-insurance. Deductibles can really vary. Most plans don't have deductibles and even help pay your Medicare Part A deductible. However, there are high deductible plans in some states that often have low premiums. Plans K and L have out-of-pocket annual limits. If you reach the limit, the plan may pay your Medicare costs for the rest of the year. Your first opportunity to sign up for one of these plans is during your Medigap open enrollment period. You have to be enrolled in Medicare Part A and Part B, and this 6-month window starts the first month that you're both 65 or older and enrolled in Medicare Part B. If this option appeals to you, it's generally smart to sign up during this time. You can apply for a plan anytime, but after your Medigap OEP, you might be denied or charged more due to health conditions. So now that you have the basics when it comes to your options, how do you sign up? First, you'll need to make sure you're enrolled in Original Medicare Part A and Part B. If you are currently receiving Social Security, you may be automatically signed up. If not, you can sign up through Social Security in most cases if you visit ssa.gov. Here is a simple breakdown of the options we've discussed in this video. Some of them have specific enrollment periods, but you can generally sign up for any of them when you first qualify for Medicare. That's why it's smart to start deciding now what type you want. When you first qualify for Medicare, there's a 7-month initial enrollment period. This is a good time to sign up for coverage that's right for you. The annual election period happens every year from October 15th to December 7th. If you missed your Medicare initial enrollment period, this is the window when you can change your coverage. It's a great time to do some research to find the options and prices that best fit your needs. A great place to do that, shop, compare, and enroll, is on the eHealth website. You just enter your zip code and voila, it displays plans available in your area. You can even enter your prescriptions to see if they're covered, or find out if your doctor participates. Super easy. Well, I sure hope this has helped you on your Medicare journey. If you have questions, visit the eHealth website or call to speak to a licensed eHealth insurance agent. Thanks for watching.